Viral hepatitis is a serious health concern that affects millions of people around the world. It is an inflammation of the liver, a vital organ responsible for filtering toxins from the blood, digesting food, and storing energy. When the liver is inflamed, it cannot function properly, leading to a range of health problems. The most common cause of viral hepatitis is infection with one of 5 hepatitis viruses, A, B, C, D, and E. These viruses are spread through different routes and can cause both short-term or acute and long-term or chronic infections. Acute hepatitis often presents with flu-like symptoms such as fatigue, nausea, and jaundice, which is yellowing of the skin and eyes. In some cases, acute hepatitis can resolve on its own without causing lasting liver damage. However, in other cases, it can progress to chronic hepatitis. Chronic hepatitis is a long-term infection that can silently damage the liver over many years. If left untreated, it can lead to serious complications such as cirrhosis, which is scarring of the liver, liver failure, and liver cancer. Hepatitis A is highly contagious and typically spreads through contaminated food and water. This means that it can spread easily in areas with poor sanitation. Fortunately, hepatitis A usually causes only a short-term infection, and most people recover fully. There is also a vaccine available to prevent hepatitis A infection. Hepatitis B is spread through contact with infected blood and other bodily fluids. This can happen through sharing needles, unprotected sex, or from mother to baby during childbirth. Hepatitis B can cause both acute and chronic infections. While there is no cure for chronic hepatitis B, antiviral medications can help to manage the virus and prevent further liver damage. Vaccination is also available to prevent hepatitis B infection. Hepatitis C, like hepatitis B, is spread through contact with infected blood. Sharing needles is a common way to contract hepatitis C. It often causes a silent infection, meaning that many people do not know they have it until they develop liver damage. Chronic hepatitis. C can be cured with antiviral medications. Hepatitis D is a less common type of hepatitis that only infects people who are already infected with hepatitis B. It is spread through contact with infected blood and can make a hepatitis B infection more severe. Hepatitis E, similar to hepatitis A, is primarily spread through contaminated food and water. It is most common in developing countries with limited access to clean water and sanitation. Hepatitis E usually causes an acute infection, and most people recover fully. The symptoms of viral hepatitis can vary depending on the type of virus, the stage of infection, and the individual's overall health. Some people with acute hepatitis may not experience any symptoms at all, while others may develop flu-like symptoms such as fatigue and weakness, loss of appetite, nausea and vomiting, abdominal pain, dark urine, clay-colored stools, and yellowing of the skin and eyes, which is called jaundice. As the infection progresses to chronic hepatitis, the liver damage can lead to more serious symptoms, including fluid retention in the abdomen, which is called ascites, swelling in the legs and feet, easy bruising or bleeding, and confusion and disorientation. If you experience any of these symptoms, it's important to see a doctor right away to get tested for hepatitis. Early diagnosis and treatment are crucial for preventing serious liver damage. Diagnosing viral hepatitis typically involves a combination of a medical history and physical exam, where the doctor will ask about your symptoms, medical history, and any potential exposures to hepatitis viruses. Blood tests can detect the presence of hepatitis viruses in the blood and assess liver function. Imaging tests, such as ultrasound or MRI, may be used to visualize the liver and check for any damage. Treatment for viral hepatitis depends on the type of virus and the stage of infection. Antiviral medications are available for chronic hepatitis B and C and can significantly reduce the risk of liver damage and other complications. In some cases, a liver transplant may be necessary if the liver has been severely damaged. In addition to medical treatment, there are things you can do to help manage your symptoms and support your liver health. Get plenty of rest, since fatigue is a common symptom of hepatitis, so it's important to listen to your body and get enough rest. Eat a healthy diet as a balanced diet that is low in fat and salt can help to support liver function. Avoid alcohol because alcohol can further damage the liver, so it's important to avoid it altogether if you have hepatitis. Stay hydrated, since drinking plenty of fluids can help to flush toxins from the body and prevent dehydration. Preventing viral hepatitis involves a multifaceted approach. Vaccination is available for hepatitis A and B and is highly effective in preventing these infections. Safe food and water practices are important, so be sure to wash your hands thoroughly with soap and water after using the toilet, before preparing food, and after contact with animals. Drink water from safe sources or boil it before drinking. When traveling to areas with poor sanitation, be cautious about consuming food and drinks. Safe sex practices are also key, so practice safe sex by using condoms to reduce the risk of sexually transmitted infections, including hepatitis B. Avoid sharing needles, since never sharing needles for any reason can help to prevent the spread of blood-borne viruses like hepatitis B and C. By understanding the different types of viral hepatitis, their modes of transmission, and available prevention strategies, we can take proactive steps to protect ourselves and our communities from this global health threat. If you have any concerns about your risk of hepatitis or are experiencing any symptoms, consult a healthcare professional for proper diagnosis and management.